Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 31 of Lengthening Live, where the patients get to interview the guests. And today I'm joined by a very special individual. We're joined by Michaela, who was a leg length discrepancy patient from years past. Michaela's story in a nutshell is basically that she was playing soccer when she was young, and she broke her femur bone, and it damaged the growth plate. And time passed, and she ended up with a near 4 centimeter discrepancy, which caused a lot of problems. So she had lengthening done, and she is here to tell her story. Welcome to the show, Michaela.
Thanks for having me, Victor. Happy to be here.
Absolutely. So Michaela, I read about your story when you reached out to me, and this is super inspirational. There's so many people out there with the leg length discrepancy. Yours truly had one as well. And it's even more impactful for people who are athletes because, they're very active and it can affect their sports, their performance, and, even their recovery to get back to it. So if you don't mind, I want to ask about, if you can tell a brief summary about your story so all the listeners can understand a little bit better.
Sure, absolutely. I think to start, obviously, like you said, I was 15 when I realized I had the discrepancy. So I met with my surgeon initially, and right off the get go, he knew I was pretty active. I wanted to get back to playing pretty high level sports. My goal was to play soccer in college. So we kind of both had that end goal in mind. And I remember on my initial visit, I'm sure you read it, he told me I'd be better, faster, stronger than I was before. And he was
Mhm.
completely right about that. So shout out to my surgeon. um, so yeah, I think just like being an athlete yourself, you have that innate drive to kind of push through whatever life throws at you. So if you've got that end goal in mind, you can get through obviously the hardships that having a leg length discrepancy and having the reconstructive surgery, you
Yeah.
can get through those hardships.
Absolutely. So, Michaela, take us back to the day when you first broke your leg, when you were playing soccer. I think you were a 10-year-old girl. And I think it was like the ball was coming your way and you try to slide and stop it. And then all of a sudden the goalie was coming your way too. And it was a collision. What was that impact like? What did it feel like to break your leg? Because I know what it felt like to break my leg, and it's not fun, but take us back to the initial pain.
Sure, yeah. So as you know, like not fun at all. It was the first time I'd ever injured anything in my life. I was 10 years old. I thought I was, indestructible. So my teammate passed me a through ball and it was a little bit, too far in front. So the goalie was coming out as I was like sliding to get the ball and I didn't score, unfortunately. I do remember that. So we collided and I went to get up and I happened to like look down at my femur and it just something didn't look right. It was kind of like sticking out to the side, not through the skin, but I knew something wasn't right. So I started screaming, and obviously the ambulance came. But I think my body instantly went into shock, and I didn't really feel pain initially until we were like hitting the bumps on the way to the hospital. But yeah, I didn't have much pain initially.
Okay, yeah, so the body went to shock. I think mine did too, for that broken leg. I had a few others, but very cool. That's awesome that you remember that. So you're taking us to the hospital. I think you went to a different orthopedic hospital, and they were did they refer you to a different to Dr. Rozbruch, or how did you get there?
Yeah, yeah. So I was 10 when the initial injury happened, and it was just a clean fracture. So they were able to same day kind of put the bone back into place, screw it into place with two screws, and then they kind of discharged me home that same day.
Okay.
Flash forward, I made full recovery, was able to return to soccer, running, everything. And then when I was 15, I was playing soccer, obviously, in high school, and I kept having this knee pain. And I was like, something's not right. And I went to see my trainer, and he was like, oh, yeah, they did the measurement.
Mhm.
They're like, oh, yeah, it looks like a 2 centimeter, like one, because I told him, I'm like, one of my pant legs is longer.
Yeah.
And I was like, my mom thinks I'm crazy, but like, tell me I'm not crazy. So he measured, and it was like a 2 centimeter difference between my legs. And then so my mom and I went back to Hamilton Orthopedics and they took
Mhm.
x-rays. And then, they were kind of explaining what the deformity was. And my
Mhm.
surgeon that had initially done the surgery was like, I'm not super confident what I could do could get you back to the level that you want to be at. So thank God he obviously referred me to Dr. Rozbruch. And
And
from there,
then
yeah, the
and
rest
then
is
you
history.
and then you're at Dr. Rosbrook at the HSS, the great hospital. Awesome, very cool. Now, when you got to Dr. Rosbrook, how did he approach the situation? What was his demeanor like? Was he freaked out, or was he like, "Hey, look, this is something completely normal that I see every day, and I can handle this.
Yeah, yeah. I mean, I remember being like a 15-year-old girl, and I just, had the utmost respect from him from day one. He very confident, assuaged all my, fears and all of that. He's just top-notch doctor all the way around from, how he treats his patients just to the level of, expertise that he has. But yeah, from the get-go, they were like, "Listen, we can fix this. Like it's not the end of the world." And that to my mom and I, that was like music to our ears kind of thing.
Right. Yeah, awesome. That's very cool. Yeah, it's reassuring to hear that. The same thing happened to me. It was like, man, am I going to live with this for the rest of my life? And
Yeah.
my doctor did the same thing. So these limb lengthening surgeons are truly amazing. Now, I want to. What was his surgical treatment? Because there's multiple, ways to get around this to fix a leg length discrepancy, and it was in your femur. And this is back in 2011, I think. Yeah, so all the fancy devices that we have nowadays weren't out just yet. In fact, I think the precise nail didn't come out until later in 2012. 2011 was developed. So what did Dr. Rozbruch end up doing to help you fix this discrepancy?
Listen, I know. I think about this every day. I'm like, if only I had waited a year, you know what I mean? But then they could have done it all internally. But yes, I had, and you have experience I saw from your story with the
Yeah,
external fixator.
I
So
do. Yeah.
yeah, not a great time, but you know what? It helped, so I'm thankful for it. But yeah, so they inserted the monolateral external fixator. So
Mhm,
on the day of surgery, they went in, did the osteotomy, cut the bone, corrected it, and
mhm.
then implanted the external fixator. So I had 6 pins going in through my femur,
Wow.
which wasn't a great look. I looked like the bionic woman just kind of walking around.
Yeah. That's so funny. Yeah, no, it's true. And going through the femurs, there's a lot more soft tissue muscle there, so it's a
Yeah.
little bit more painful. I know that I had that X fix there in the femur as well. And going through all that muscle, it's just moving, minute movements. You can feel a lot of that soreness.
Mhm.
Tell us like about your experience wearing the X fix. Out and about. What was it like cleaning it? And doing physical therapy because you can't just sit mobile, immobile for months on end.
No, for sure. So I remember, I think I had like a 5-day like hospital stay
Hmm.
when I had the surgery initially, and that's like pretty unheard of now. I think they want to get you in, get you out.
Yeah.
Obviously leads to better outcomes, all of that. So pretty early on, they were like, "Listen, we got to bend your knee, got to bend your knee. If you
Mhm.
don't get that knee bent, at least to 90, then they would have to like go in and do like a patellar release, all this extra stuff." So I knew early on I had to like work pretty hard to bend my knee.
Mhm.
So PT, like post op, I think it was like day one or day zero. So
Okay.
I knew obviously that was going to be a challenge. And then I had PT in the home.
Mhm.
So they would come. Yeah,
I
have you
remember
had
that.
experience? Yeah.
Yeah.
So they would come and I'd go out with my crutches, and I had this one chair in my living room, and I called it the electric chair because I'm like, I had to do all my exercises there and I hated it. Um,
Electric chair, like it's half death, Right.
Literally, yeah. So, like you said, like tons of soft tissue there, and obviously, like the distal pin sites were right by my knee joint, so tough to bend the knee. Obviously, once the fixator was out, made it a lot easier to bend the knee, so that was good. But yeah, I think in total I was in PT for maybe like 9 months between like
Wow.
inpatient acute all the way to like outpatient. So
Oh my gosh, that's crazy. Yeah, I think mine was about 7 or 8 months, or
yeah,
so with the PT because it's yeah, when you're immobile like that, it's really hard. Um, Michaela, what was when you were because I think that I read that you said you were on the sidelines of soccer practice with this X fix, and I mean, obviously people see you with this. What did anybody make any comments about this when you were wearing it out, and what was your explanation?
did anyone ask you about it? Right.
I know,
So
yeah.
it's like, who didn't, right?
Right, yeah.
You get everything from like, "Hey, can you take that off?" Like, I wish I wish I could
I got
unscrew
that.
this. Um, but yeah, I mean, everyone would be like, "How is that attached to your bone?" Because obviously it's covered with gauze, so like they can't see the pin signs. So
Right.
yeah, you get all the questions, and it was hard obviously being on the sidelines of soccer because I'm like, I just wanna be out there with my team essentially. But that was also like a huge motivating factor for me. It's like I can't play right now. I'm literally I would do anything to be able to play. So
Yeah.
that
Mhm.
just made, like, me wanting to come back and play even more of a
Even
drive.
more. Yeah,
Yeah.
that's the same thing with me. It's like when you are sidelined because of this, the one thing that you think about in the back of your head is like, "I can't wait to get back," and that's what happened
Mhm.
with me with my surgery. I was like, "Man, can't wait to get back to the stage and win," and after that happened, I never placed lower than 3rd, so it's super cool.
Wow, that's so
Now, Michaela, I wanna ask a little bit more about the problem of the discrepancy. So you had a 4 centimeter discrepancy in the femur. What were some of the issues that you faced? Because there's a lot of patients out there, parents of patients out there, who their children and or themselves are suffering because of this, condition. I know that I did lower back pain, joint pain, and all that kind of stuff, especially as an athlete. Can you talk a little bit more about your experience?
great question, Victor. I think that I hit a growth spurt the same year that I started experiencing pain.
Mhm.
So it was like hit the growth spurt, instantly started experiencing pain. My body compensated so well. Like they did like a gait analysis on me and they couldn't even really tell
Yeah.
until they took the x-rays just because my body compensated so well. So thank goodness I never got to the point where I even had like a functional scoliosis or anything like that. Like
Right.
everything was pretty good. It was thankfully localized to just my knee and my femur. So, but
Oh,
yeah,
very
that's
cool.
a huge concern to have.
Absolutely. I'm so grateful that you didn't have as bad a, impact as a lot of people do, but yeah, a lot of people catch it. I mean, good thing you caught it pretty early too.
That's it. Yeah,
Yeah, for
I
sure.
think that was key.
Awesome, very cool. So, Michaela, nowadays from soccer superstar to a physical therapist. Because if anybody doesn't know, Michaela is now a doctor of physical therapy. So, hats off to her.
Well,
But now you really understand it from the perspective of a provider,
mhm.
and you were a patient as well. So, can you make the connection of how important physical therapy rehab is for a condition like this?
Yeah, absolutely. I think, especially obviously with like limb lengthening, you it's ever changing, right? The rehab process is ever changing. You're trying to push, 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 and then there's constant, lengthening of the tissues. So it's definitely like a unique nuance
Mhm.
in that realm. But with any orthopedic injury, like just getting through the day to day is kind of
Yeah,
the biggest thing is take those little mini milestones. I even as a PT tell my patients, listen, on day one you had this range of motion and it was painful, now you're able to do this and pain free, because sometimes patients forget, right? They're like, I had all this pain, I was unable to do x y and z, now I'm having less pain and I am able to do x y and z. So kind of
absolutely.
taking those like little victories, because they end
Mhm.
up being the big victories in the long run.
100%. Yeah, they all add up in the end. That's very cool. Um, awesome. Yeah, so that I mean, that kinda covers a lot of what I wanted to kinda talk about today because your story was so, straightforward, but you were just strong. But one thing I wanted to touch on is the mindset, the mental fortitude that you had to have, the grit, if you will, going through something like this because here you are, a very young girl, an athlete no less, and you're going through one of the most, bizarre procedures there is really for orthopedics. What was your do you feel like you, became tougher going through something like this? And do you think that you're better for it nowadays?
That is a fabulous question.
Yeah.
And I think today's day and age, just to kind of segue a little bit, I'm glad that like mental health is kind of just more out there, as it's almost as common as physical health. There's obviously like a huge gap that we still need to kind of overcome.
Mhm,
But that's a huge concern. I'm sure that you kind of went through the same thing. It takes a toll on you. Like part of your identity, especially as an athlete, is to be able bodied and to be able to compete in your sport.
mhm,
And if you take that away, I mean, you almost lose part of your identity for a little bit. And it gets depressing for sure. There were periods I was very sad and I didn't know how to kind of cope with those emotions as a 15, 16-year-old. Um, but and I do almost wish like I had someone to kind of like talk to about that.
mhm.
So hats off to you for creating this podcast. Like this is awesome just for people to have this resource and
Yeah.
know that they're not alone and they have, other people going through the same, like you said, very bizarre thing in life.
Mhm.
Like that's huge knowing that you have a community. But yeah, it I don't know. I don't know what gives people resiliency. Thankfully I've been blessed with it and I just, take whatever comes at me and say, okay, this is what it is and we kind of have to deal with it. you know?
100%. Yeah, absolutely. But, I right back at you likewise, because, having people like you come out to share their stories, because there's going to be a little girl that has the same thing and looks up to you and says, look, they can see themselves in you, and you're going to inspire them to go forward and get this done. So hats off to you as well. So very cool. Well, Michaela, before we transition into the live chat and answer some of the questions there, are there any last words that you want to say to other people who may have this condition, or even parents who have kids that may have this, to give them some sort of morale support, if you will?
Sure. I guess we could kind of talk about the recent exacerbation that I had of my
Yes,
symptoms.
yes, yes. Let's talk about that. I'm sorry. Yeah.
Yeah. No, 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 you're fine. So obviously I was telling you, I made it through my whole collegiate career pretty much pain free, was able to play obviously soccer, had the time of my life, and obviously went on to become a PT, and life was good.
Uh-huh.
And then I just, I kept having this like residual knee pain, almost similar to what I had 10 or so years ago. So
Hmm.
I just made a follow up with Dr. Rozbruch in 2020, the fall of 2020. And I said, listen, I'm having this knee pain. I'm trying to get that full knee extension, right? Like I'm a PT. I know I need that knee extension. And I just couldn't get it. It just wasn't coming. It was something structural. So I just made a follow up with him. He's like, listen, we can fix it. And I just had to get one final surgery. And they just did a, final little tune up, I call it, of my femur. So, things like that happen though. And I think, I wish I would have known even back in the day, after I was 10 and I, was having this pain when I was 15. I wish that someone maybe had told my mom, or
Hmm.
obviously I wouldn't remember as a 15-year-old, hey, if, X, Y, or Z starts to happen, or if she starts to get pain,
Hmm.
have a follow-up, because this
Absolutely.
is a possibility that this could happen.
Yeah.
I guess just like being aware that like sometimes surgery helps you, and maybe it
Hmm.
helps you for X amount of time, and maybe you just need a follow-up, and it's okay to have those follow-ups and, have those questions kind of thing.
100%. Yeah. And I want to actually dive a little bit deeper. So, for the bony protuberance, did he actually have to go in and shave it off, or what did Dr. Rosberg actually do?
Yeah, so like we said, I was kind of in the, maybe I was like the grandfather of the X-Fix, right? Like I was
Yeah.
on the very tail end of that. So um I guess maybe it wasn't like as precise. I don't, did you have the precise nail?
I had that as well, but I had an X fix in my femur.
Yeah.
Yeah, yeah.
Yeah.
I know. I'm the literal cyborg. So.
That's awesome. Unreal. So yeah, mine's not nearly as bad as yours. No, but so mine obviously, did they lengthen with your external fixator as well?
No, that was just to hold the bone in place. Yeah.
Okay, okay. So he said, like, my surgeon kind of made it sound like maybe there was just like a little bit with the external fixator that didn't quite account for the flexion deformity.
Okay.
So I just had a remaining flexion deformity in my femur. So if you can imagine, the femur bone's bent a little bit, so it's going to
Hmm.
kind of inhibit that terminal knee extension. So you can't really straighten your leg out all the way.
I see.
So it was kind of causing me a little bit of pain on the front of my knee, giving me a little bit of early onset, kneecap arthritis kind of thing
Hmm.
underneath the kneecap. So I was like, something's not right. My knee is very crunchy. I'm only 25. Like I gotta get this looked at. I'm too young for this.
Right.
So yeah, so what they did in this final surgery, they just did another osteotomy,
Okay.
fixed the flexion deformity. Nothing is crazy. So I think they did like a closed wedge technique
Okay. Yeah.
in surgery, and then inserted a plate and screws
Yeah.
just to kind of fix it. And then I got the plate and screws removed this past year.
Nice, nice, awesome. Yeah, I mean, that kind of wraps up the whole kind of process, because
Yeah.
you were kind of like, this had this little lingering issue, but he kind of fixed it all up. That's so
Yeah,
cool. Dr.
absolutely.
Rosbrook, he's the precisionist, so
Oh, he's the man. Yeah, absolutely.
I love it. Very cool. So yeah, I mean, that's super inspirational, and I'm so grateful that you came on to share that with everybody. Now I want to hop into the live chat, because I think we have a few questions in there.
Sure.
Let's see here. So we have Benjamin Mendoza. He's one of our top contributors here. So he's asking, how much did you lengthen on your femurs? So it was her femur, so she was a discrepancy patient. But yeah, if you want to answer that, Michaela.
Sure. Yeah. So 4 centimeters. So
Mhm.
it was about an inch and a half.
Yeah.
And it was the cause of, I had a obviously growth arrest after that growth plate injury when I was 10.
Hmm. Gotcha. All right, let's see here. So Baki Gaines is, I'm considering limb lengthening. He's 5'9", and he's asking, he has thick leg bones. Will it be more painful for me or no? So I guess that is more of a surgeon question. So I guess we can't really, but you can try, but I don't know.
Listen, I say if you've got thick leg bones, they'll probably heal back twice as thick. So I say
Yeah.
go for it. Yeah.
All right, let's see here. Okay, so Ben is asking, did you feel any tightness when you reached that 3.5 to 4 centimeter mark? That's a good question.
That's a really good question. Honestly, Benjamin, I would say throughout the whole kind of process, it does feel pretty tight. With my lengthening, I don't know how they do it now. I was doing like a millimeter a day, so it
Hmm.
was pretty consistent tightness throughout until we did reach that, ideal height and then fixed it. But yeah, I would say pretty even tightness throughout.
Pretty even tightness. Yeah. And plus she was an athlete, so she was working hard on that physical therapy and rehab. So awesome. All right. Yeah, there's probably not a whole lot of questions because I literally put this out like it was very last minute. I
Oh,
appreciate you coming on last minute, but I have to
yeah, of
travel this
course.
Wednesday and I was like, let me get it in today because I know Wednesday morning I gotta fly out at 6 a.m. So
All right.
I really appreciate you coming out. But
Okay.
one thing is that if there is a patient who has a similar condition to you, or a parent who has a child who has a similar condition to you, do you have any way of connecting online, like maybe social media, or do you have an email? Because you're a physical therapist as well. Where are you based, Michaela?
I'm actually a traveling PT, so I'm in
Uh,
Connecticut currently. Yeah.
Connecticut. Okay.
Yep.
Awesome. So if you're in Connecticut and you're getting limb lengthening done and you need somebody to kind of help you out, hit up Michaela. So awesome. So do you have any like kind of like connection thing, or do you not want to?
Yeah, absolutely. I can send you, my information in an
Sure.
email if that works for you.
Absolutely, and I'll just, like, post it below the video. That way, if anybody has any, questions for you, they can reach out. Let's see, any other last questions here? Just double check because I think some people okay, here we go. Did you have any complications, during your process?
Really good question. Yes,
Mhm,
and I think that this complication would probably be pretty much obsolete anymore. Um, Around I think the 6-week mark with my external fixator, the distal pins started just kind of rotating out to the side. So instead
mhm.
of like it being nice and aligned, it was just kind of rotating out.
Okay.
I
Yeah.
don't really know why that happened. I don't, yeah, but anyway, so instead of just doing like the vertical turns, I had to do lateral turns as well just to kind of correct for that.
Mhm.
So when that happened, obviously, if the bone is kind of out there, the bony matrix just started kind of forming in that soft
Mhm.
tissue. So after they did correct for that,
Yeah.
I did have a little extra bone growth out there that I just had to get removed in another surgery. So
I gotcha. Yeah.
nothing too crazy, but I don't think that would happen anymore because
Yeah, because of all the technology they have nowadays.
yeah, exactly.
That's crazy because yeah, you had it done in 2011, and I had it done a year later than you, in 2012, and the Precise had just come out in that time. You would have had the Precise now. Oh, look at that.
I'm sure was that a lot different? How
It
was that?
was. It was because I had it in my tibia, and, to tell you the truth, that, it was because I had the X-Fix, and it was just, for one, so much easier to, like, lay down and sleep and just, like, be with that thing inside the bone. Um, but, I think because your flexion deformity, maybe he had to use the monolateral, X-Fix on you. I'm not sure. Rozbruch he
Oh,
always has a reason for what he does. I mean, he's a very, very good surgeon, and he doesn't play when he does what he does, but, hey, if you could rewind time and wait one more year.
I know, right? I think we did ask him because obviously, like you said, it was coming out around that time that I had it, and I think you
Yeah,
might because I had 3 areas of deformity, so I think
yeah.
it might have been a little too tricky to do the
With a single,
larger, yeah,
rod, for sure.
absolutely.
I know because you had that accident, yeah. Let's see, any last questions here? We have, one chosen potato. He's saying, "Just joined, but did you get any tibia lengthening?" No, she got femur lengthening, didn't any long-term risk. So, she was speaking about, potential arthritis if she didn't get this fixed, um, earlier, but, yeah, that's pretty much the main, reason why a lot of discrepancy patients will get it done. So,
And
all right, guys. Any other last questions for Michaela here? This is your chance to ask a limb length discrepancy pro and now physical therapist, soccer superstar. If you guys are athletes, you want to ask her anything, now's your chance. But all right, guys. All right. Well, Michaela, I want to thank you so much for coming out and sharing your story. I really appreciate it. I wish you the best on when was your last surgery? That was in 2021 or
2021, yep, March of
2020?
2021,
March
and
of
then I
2020.
just got the hardware removed last month, so March
Last
of
month. Okay.
2021.
Are you still feeling any residual effects or are you okay?
I'm pretty good, yeah, pretty
Yeah.
good. Still
Awesome.
working on my range of motion and such, but
Yeah. Well, you know what to do. You're the expert. So, all right. Well, I wish you the best, and yeah, we'll talk again in the future.
yeah, awesome. Thanks so much for having me, Victor. I love what you're doing, so keep up the good work.
Absolutely. Thanks so much. All right,
Thank
guys.
you.
Until next time, we'll see you. This is Victor from Cyborg for Life signing out. Peace.